Good morning and welcome to COVID-19 Town Hall, Allergies, Pregnancy, Chronic Conditions, and the COVID-19 Vaccine. My name is Alfreda Rooks, and I am the Director of Community Health Services for Michigan Medicine. It is a pleasure to be here with you this morning to share with you our fourth in a series of town halls designed to provide you with information to assist you in making the best decision for your health. As of June 3rd, according to Becker's Hospital Review, we only had about 45% of people in the United States who have been vaccinated. Michigan ranks 25th with 42% of the population fully vaccinated. And locally in Washtenaw County, 51.6% of people between the ages of 12 and 64 have been fully vaccinated, and 85% of folks 65 and older. We know there are still questions that people have, and so we're hoping that today we can provide you with additional information that relates to specific conditions that will help you to make an informed decision for your health. This information is not intended to be medical advice, but is provided for educational and informational purposes only. We encourage you to contact your primary care physician or specialist to receive the best information for your health state. If you do not have a primary care physician, please let us know. We'll be happy to connect you with resources. Also this morning, we want this to be a sharing platform. Some of the questions that have come forward through just about every town hall that we have, especially as it relates to vaccine hesitancy, is what can you say? What can you talk to people to encourage them to be vaccinated? Well, I think that when we have conversations, when we have dialogue, and when we share our stories, that's one of the ways that we can connect with people. And again, the intention is always to help people make sure they have the best information to make the informed decision for their care. So if you have some ideas, some things that have worked for you and what you have done with your family members or your friends, then please feel free to drop that in the Facebook chat, put it in the chat in the Zoom or Facebook comments, and we will share that. Thank you. Okay. And so this morning, I'd like to introduce our panelists. Our first panelist is Anthony Williamson. Mr. Williamson is the Director of the College and Career Readiness at Washtenaw Community College and the Community Development Director for Park Ridge Community Center. Anthony began his education at Washtenaw Community College and later received his bachelor's degree in criminal justice and master's degree in social work from Eastern Michigan. After brief stints with Ypsilanti Housing Commission and Eastern Michigan University, Anthony returned to Washtenaw Community College. In 2012, he was instrumental in the partnership between Washtenaw Community College and the city of Ypsilanti that resulted in expanded programming at Park Ridge. Park Ridge offers after-school programming, summer camp, and adult and senior classes like sewing and line dancing. In addition, community partners provide youth mentoring, English as a second language, fine arts, music, and more at Park Ridge. Anthony believes kids who are exposed to WCC through Park Ridge can learn firsthand that college is accessible to them. And he has served on numerous boards in the community and is a recipient of the NAACP Prestigious Civil Rights Carter G. Woodson Award. And this is also Mr. Williamson's birthday, and so happy birthday to you. Many happy returns for the day, and thank you for joining us this morning. We appreciate you being here.
Thank you.
Next is Dr. Dilawar Kolkar, who is a fellow at the Allergy and Immunology Clinic at Michigan Medicine. He earned his medical degree from the University of Virginia School of Medicine and completed his residency at the University of Virginia in internal medicine. In addition, he received his bachelor and many opportunities to teach and mentor medical students and residents at both U of M and the University of Virginia. His research interests includes food allergies, mast cell disorders, and drug allergies. And finally, this morning, I'd like to welcome Dr. Shaquita Berg, who is a board certified in obstetrics and gynecology. She earned her medical degree from the Wayne State University School of Medicine and completed her obstetrics and gynecology residence at St. Joseph Mercy Hospital. She has a Master of Business Administration from the University of Michigan and a Bachelor of Science in Biology from the University of Miami. Dr. Berg has clinical interests in abnormal uterine bleeding, uterine fibroids, adolescent teen care, PCOS, infertility, and reducing health disparities among vulnerable populations. Good morning and welcome, Dr. Berg. We appreciate you being here as well. And so to start out this morning, we have always found that when we can have someone who will talk about their experiences, that sharing of these stories is very powerful. And also, it provides two things. It let us know that there are others who think about the things that we think about. It's not just us. But also, it makes us feel like we're part of a community of people who are learning and who are sharing. And so, with that, I would like to ask Mr. Williamson if he would be willing to share his story about why he, chose to get vaccinated, and any concerns that you've heard from community members in your work at Park Ridge Community Center about their concerns. So, Mr. Williamson.
Thank you. And first of all, thanks so much for the invitation. I've been working with the program for multicultural health for a lot of years. I was a graduate student in that program as well, and they've partnered with us for, I can't tell you how many things we've done at Park Ridge. So it was an honor for me just to be asked. But I guess what I will share is right before Thanksgiving, in an effort to plan for opening for Park Ridge's partnership with Ypsilanti Community Schools for learning labs. So we currently offer our space as a learning lab in support for the school district. So just to make sure everything was taken care of, I took my flu shot and I got a COVID test the same day. And I don't know why. And I took it in Canton because there was nothing available in Ann Arbor. My wife is connected in the health field as well. So she found me a place in Canton to take my my COVID test. And when I left there, I called her and I told her, they're gonna tell me I had COVID. I just felt it, right? A couple of days later, I have COVID. I didn't have any symptoms. So I've always been the person, I listen to the news, I hear what people say, I trust my health profession. Again, my wife has been connected with a very well-respected hypertension doctor for 25 years. So I get my health information from her, but I had no symptoms. They did make me stay in the basement for 10 days, which I fell in love with my basement, but I had no symptoms. And so I was curious to know, like, why didn't I? Either I was asymptomatic, it was a bad test, or I'm Superman, but had zero symptoms. And so when I talked to my friends and family about it, and kind of as a skeptic, I didn't have any symptoms, may not be that bad, but then I started running into my friends who had major symptoms. As a matter of fact, my wife, who thought she had a cold right before COVID was officially announced, stayed sick for probably about 3 weeks, and she was very sick. And so as we started to have conversations, when I was telling people I didn't have any symptoms, more of my friends started to tell me that they also had these symptoms or was diagnosed with COVID. And so I would kind of weigh like, okay, I didn't have these symptoms. A lot of people don't have symptoms. People in the community don't want to take the test. They don't want to know what's going on with them health-wise. And so my job now, especially I'm a social worker more than anything else. I do my thing with education, always wanted to be a teacher, but by profession, I'm a social worker. And so my job is to educate my community about anything that can be a positive benefit or detriment to them. And so what I started doing is going around talking to folks about my experiences, but also sharing theirs. We had a couple of, we won't call them town hall meetings because technically we wasn't supposed to be inside the facility, but we had conversations with seniors and others just to find out what was going on and how we can be supportive to the community. So then the testing came around. I was a skeptic again. My wife, who any of you who married know, my wife is the lead of the house, even though we may think that we are. So she, again, with her health connection with her health professionals, all of them told her she needs to take the vaccine. She works at U of M. They were getting them the vaccine early. So she did. I waited a week or two, but the reason why I took it is because my wife took it and instructed me to take it. But I also have a mom who has a lot of ailments. I have grandchildren who I want to be around. I have friends and colleagues that I want to be around. I also have these children that I work with in the community that I have to be around in order for them to have connection with a positive male role model. And so that's the reason why I took it. But now what we're working on is how do we get those, and what we're saying now is the people who haven't taken it now, because you mentioned, I think 51% in Washington County, but I was told, I don't know how official this is, but I was told that the area where I work in the south end of of Washtenaw County has a very high number of people who've taken the vaccine, maybe one of the highest in the county, which is something that's really good for our community, but we're not usually the best in anything. And so as we're trying to get other people to take the vaccine, to understand its importance and provide education to them, because a lot of people, is about one, who they get the information from. I got mine from doctors at the University of Michigan. I think that's a pretty good reference. Some of them get theirs from, and I'm joking when I say this, the guy who's in front of the beer and wine store. He doesn't have any expertise, but whatever experience he has, he shares that with people in the community, and they take that as, oh, I'm not taking it because Big Bob said that such and such happened. And so what we're trying to do now is provide some education. I'm working with Washtenaw County and the Michigan Work Service Center now and trying to develop some PSAs from who we call trusted community advocates. So we'll make this video, we're gonna make it next week. So Trudy or Frida, I may be calling you for a cameo, but just to provide education and communication with people they trust, so we can set up a vaccine June 25th at the Michigan Works Service Center. And we're even expanding out to the, 12 to 16-year-old. So as a social worker, I just believe it's important, if this is what we need to do in order to get our communities well, then how do we educate people, make them talk and interact with people that they're comfortable with, that they trust. I've been in that community for 25 years. They trust me with a lot of things. I always tell them I'm not a healthcare professional, but I'm connected to people who know the information, and I want to get that information shared to them. So that's kind of my story about my not only having COVID, why I took the vaccine, and then what I'm doing now to try to get more people within my community to take the vaccine and understand why it's important. Now, the reason I asked to, or even RSVP for this, because I wasn't a panelist initially, but I RSVP because one, my relationship with Trudy, but another one of my colleagues I work with, we had a kind of heated discussion about the education part of taking the vaccine, and she wants more education. So I asked her, did she take the shot? And she says no, and we're having this discussion. Like, what do you mean no? Well, because something about her immune system that she has to get. And so people don't know those things too. So it's other reasons why people shouldn't take the vaccine, and our community needs to be educated about that. So that's one of the reasons why I said I want to participate in this and learn more so I can share. I can talk all day, but that's about it. Thank you.
No, thank you for sharing that. And that is important. The more information that we have, we're not telling everybody go do, but we're telling people get the information so that you understand what the best choice is for you. And I think one of the things that had been kind of a hindrance for folks is that when the vaccine came out, there was concerns about how fast it was developed and how quickly it was going on. We don't know enough. We don't know enough. Well, now we've been doing vaccinations for about 6 months or so. And so we do have a little bit more information. And that's why I'm glad to welcome Dr. Kokar here this morning so that he can talk a little bit about what have we learned about the COVID-19 vaccine and allergies and what people should be aware of. And so Dr. Kokar, I'll turn it over to you.
Thank you for having me here this morning to speak with all of you about the vaccine. I really appreciate it. And my job here today is to give you folks more information about what we know about allergies and the vaccine so you can make an informed decision.
And next slide, please. Okay, there you go.
So I'd like to start off by saying that the person who knows you best is your own personal physician. They know what medications you're on, what your health conditions are. They know you as a person, what's important to you as an individual. And that's the best person to advise you about an individual individual decision about your health, including getting the COVID vaccine. And so I'm going to give you a lot of general information today about the topic and what we know as a medical community. But ultimately, I think the person that knows you best from a healthcare standpoint, your personal healthcare provider, is the best person to help you make a decision about the vaccine. And also, as you folks know, from all the media coverage about COVID and the COVID vaccines, what we're learning is changing every day. And so what I'm going to present today is current as of June 2021. But as we get more information, some of this might change in the future. So I'll be discussing vaccine reactions, side effects, allergies, what are the ingredients in the vaccines that people worry about, as well as specifically the different types of reactions to the Pfizer, Moderna, and Johnson & Johnson, sometimes referred to as the Janssen vaccine, as well as specific patient cases and scenarios that come up in my practice in the allergy division here in terms of patients with immune conditions, allergies, folks that might be immunocompromised, and then kind of summarize everything at the end. So I think it's important to make a distinction between side effects, reactions, and allergies. So not all reactions are allergies. So if you have symptoms after an exposure, whether that's a vaccine or oral medicine or a food, we often call them allergies. But in the medical world, when we use the term allergy, that's very different from how other folks may use it. And so usually when I use the word allergy, I mean it's a reaction caused by your immune system that can potentially be life-threatening and needs an EpiPen for treatment. But a lot of what folks experience are more expected side effects or non-allergic type symptoms. And so when I talk about side effects with vaccines, you can kind of think of them as two big groups: things that happen at the place where you get your shot, in the case of the COVID vaccine, your arm, and then things that might happen away from that area, or what we call systemic symptoms. So your things that may happen at the shot site include like redness, pain, a little bit of swelling, very common with many vaccines, not just the COVID-19 vaccines. And then some people may feel a little achy, have some muscle pain, low-grade fever, feel a little fatigued. So that's more of what we call a systemic effect. It's a side effect because you're activating the immune system, but it's not happening at that specific spot where you got the shot. And then another thing that comes up often is vasovagal reactions. That's a fancy term for what you often see in movies, or what happened to you in the doctor's office when you get a shot. Say if you didn't eat breakfast that day, you get a shot, you feel a little lightheaded, or you're anxious or worried about something, and then something happens and you faint for a moment. The fancy term for that is vasovagal. And that is not an allergic reaction. It's not treated with epinephrine. People typically recover very quickly. And a lot of folks know what to do to avoid this from happening in the future. For example, I have some patients that know if they're getting a shot in the office that they need to eat a big breakfast that day or drink more fluids to avoid this type of thing from happening. And the symptoms of this include like cold and clammy skin, feeling of warmth. You might feel a little lightheaded or dizzy, feel a little nauseous, but this is not an allergic type reaction. And so what are the COVID-19 vaccine side effects? So what should you expect if you get the COVID-19 vaccine? So for the messenger RNA vaccines, which include the Pfizer and Moderna vaccines, about 80 to 90% of folks will have a local symptom, meaning the place where they get the shot in their arm, they have a little bit of redness, a little bit of discomfort, a little bit of swelling. Typically that goes away in a few days. And depending on the age group you look at and what study, between 50 to 90% of folks will feel a little achy, a little fatigued, maybe a low-grade fever. And interestingly, for these vaccines, these side effects occur less often in folks that are older. So for the Pfizer vaccine, 55, from Moderna, 65, those are just the cutoffs they chose. But generally speaking, if you're above the age of 60, you'll have fewer side effects with the vaccine. And most of these occur within 3 days of vaccination and then go away within 1 to 2 days. And they can be treated with over-the-counter medications like Tylenol, for example. And then for the Janssen vaccine, 50% will have a little bit of swelling and redness at the shot site in their arm, and about 55% will have fevers, chills, or fatigue. Usually these go away within 1 to 2 days of getting the vaccine, and it's more common in patients that are younger than 60 years old. These side effects are comparable to other vaccines that are present on the market, and so it's not really unexpected things here. And so what about allergic reactions? So in general, allergic reactions to any vaccine is very rare. When you look at all the other vaccines we had before the COVID vaccines, it's an average of about 1.3 reactions per 1 million doses. So what does that mean? That means for every 1 million shots of a vaccine given, one person will have an allergic reaction. They usually occur within 15 to 30 minutes of vaccination. 90% include a skin symptom, so like flushing, hives, or swelling, for example. But can be associated with other symptoms like shortness of breath, wheezing, which is a whistling sound from the lungs, low oxygen level, low blood pressure level. You may lose consciousness, have some belly pain or vomiting or diarrhea, but 90% of these reactions include a symptom of a skin, meaning you have flushing, hives like a rash, or some sort of swelling. And then most allergic reactions to vaccines in general are due to the inactive ingredients, or what we call excipients in the medical world. So it's not the portion of the virus that's in the vaccine. So in the case of the mRNA vaccines, it's not the messenger RNA per se. It's usually the inactive components that cause the reaction. Now, I will say we are still studying allergic reactions to the COVID-19 vaccines. So right now, nobody can definitively say what in the vaccine is causing the reactions, but historically, with all the other vaccines that we've had for decades, it's been the inactive ingredients that have caused reactions in patients. So the inactive ingredients are generally added to preserve the medication or the vaccine to make it more durable so it can be transported and then distributed and used. And they may be referred to as like a coloring agent or a preservative or filler. Those are other common terms. I mentioned the word excipient. That's the fancy medical term for these inactive ingredients within the vaccine. The mRNA vaccines contain an excipient called polyethylene glycol, or PEG. That has been shown to cause allergic reactions in other medications. Allergy to PEG is very rare, but that's one of the things that folks have focused on for these reactions to the mRNA vaccines is it the PEG. I will say that nobody's definitively proven that it's the PEG, but patients that are worried about having a reaction to the mRNA vaccine, generally it's a good idea to know that it's polyethylene glycol within there. That's the thing that's being focused on right now. For the Johnson & Johnson vaccine, the major excipient that people worry about is polysorbate 80. Again, very rarely causes allergy, but in other medications that folks have received in the past and reacted to, this has been found to be the cause. So we know that in a small group of patients that it can cause potentially allergic reactions, and that's why it's one of the things that is being focused on. Again, no one's proved that it's this specific component within the Janssen vaccine that's caused reactions that have been documented so far, but it's the one we're focused on because in the past and other things, it's been an issue. And the important thing to note here is none of the vaccines contain any food protein, like eggs, for example. They don't contain any gelatin, latex, or metals such as iron, nickel, cobalt, or lithium. A lot of folks may have a food allergy or a metal allergy, like say to jewelry, for example. So those folks shouldn't worry about those things being in the vaccine. There's no food proteins and no metals that are common allergens, such as iron, nickel, or cobalt, or lithium that are present in these vaccines. So as I mentioned previously, the inactive ingredients help preserve and stabilize the vaccine. PEG is found in food, cosmetics, and a lot of medications. So there's a very good chance that everyone on this call has been exposed to PEG in some form or another during their lifetime. And so you can find it in toothpaste, skin creams. It's used in bowel preps for colonoscopy, so that nasty goopy stuff you got to drink the night before. That's a lot of PEG, way more than what's in the vaccine. And then a common over-the-counter stool softener that's used by a lot of folks, Miralax, is also polyethylene glycol. And so you're getting a lot more PEG in your day-to-day products, or if you use laxatives or had a colonoscopy before, than you are getting in this vaccine. So likely you've been exposed to PEG and not had a problem in the past. Polysorbate 80 is used mostly in the medical world, not as much in cosmetics, but it can be found in some. The big thing is for folks that have gotten vaccines in the past, either as a kid or an adult, you've probably received a vaccine that has some form of polysorbate. So influenza vaccines, tetanus vaccines, and then of course some products like ice cream and soap as well. And so most folks have been exposed to polysorbate in some form or another. So COVID-19 vaccine allergic reactions, what's been reported so far? You know, a lot of folks ask me, Doc, how likely am I to have an allergic reaction? How does this compare to other vaccines? So initially, when the vaccines first came out, there was a lot of concern about allergic reactions, and the initial rate was actually higher than what's listed here, 11 cases per 1 million shots given for the Pfizer vaccine, for example. But over time, the allergic reactions that are reported have actually decreased as more people have gotten the vaccine. So these are the current averages, about 5 per million doses for Pfizer and 2.8 per million doses for Moderna. Now, this doesn't encompass all side effects. As the slides I showed you before, a lot of people have side effects from the vaccine, but very, very, very few people have a life-threatening allergic reaction to these vaccines. And the important thing to note is that you've had thousands of patients with allergies with no reaction to these vaccines now. Folks getting vaccinated at Michigan Medicine and other hospital systems like Harvard, they have many folks that have listed allergies in their chart, have been diagnosed with different environmental allergies, food allergies, drug allergies, and many of these patients with these listed allergies do just fine. And so you'll often see in the media that the few cases that get reported, they talk about what allergies those patients have. But the thing that people often forget to mention is how many people with those same listed allergies tolerated the vaccine without a problem. And that number continues to grow. So just because the people that reacted had XYZ allergy listed doesn't mean that XYZ allergy is a risk factor. And a lot of folks talk about deaths related to the vaccine. I mean, people debate whether or not the vaccine is a cause of death in some patients, but one thing I like to point out is no one has died from an allergic reaction to these vaccines. Because as I mentioned, severe allergic reactions can be life-threatening and need an EpiPen for treatment, but no one that's had an allergic reaction to these vaccines has died from the allergic reaction to the vaccine. And you're 100 times more likely to die from COVID-19 than you are to have a serious allergic reaction to one of the mRNA vaccines. If you take all age groups from children to 80, 90-year-olds, it's about 2% average of death from COVID-19 infection, which is significantly higher than 5 in a million or 2.8 in a million chance of having a severe allergic reaction. One thing that's come up for some patients is what we call delayed large local reactions. This is something that was seen in the clinical trials and now has been reported as patients get the vaccine. It occurs in less than 1% of folks that get the vaccine and seems to be more common with Moderna, but can also happen with Pfizer. Essentially, the way this is different from a vaccine side effect is that the redness and swelling you get at the shot site occurs a few days later as opposed to a few hours after or a day or two after the vaccine. And it can stay for about a week and a half. It's not dangerous, it's not life-threatening, and you can treat it with over-the-counter meds, but it's something that could happen to you. And I've had both friends and colleagues and as well as some patients report this issue, and usually some over-the-counter like Allegra or Zyrtec hydrocortisone cream is enough to take care of it, and it gets better with conservative treatment. What are some other reactions that people talk about and worry about? So this is kind of getting into the non-allergic type reactions that may occur with some of these vaccines. So dermal filler is used in cosmetic surgery, and it's basically used to replace fatty tissue. So things on the outside look the same and kind of even. A lot of folks use this in cosmetic surgery of the face, for example. And if you have a history of one of these procedures and you've had dermal filler in the past, in a small group of patients, they've seen after getting the Moderna vaccine that you can then develop swelling where the dermal filler was used. This can be treated with steroids, and it's not a life-threatening reaction. It's just something to be aware of for a very specific group of patients. Overall, it's very rare, and there were 3 cases reported in the clinical trials, which included thousands of patients. Some patients can also develop lymph node swelling. Technically, this is a side effect because anything that activates the immune system, whether it's an infection or a vaccine, can cause lymph node swelling. But I mentioned this here because a lot of folks have focused on this because it seems to be a little bit more common with these vaccines, the lymph node swelling side effect, as compared to other vaccines in the past. So it's one of the few side effects, or maybe it's a little bit more. And I think it's important to know for specific patient groups, for example, older women that need to get mammograms for breast cancer screening. And so if you have lymph node swelling in the armpit, that can cause you to have a false positive mammogram for some patients. And so it's important to know whether or not you have lymph node swelling after the vaccine, and if your doctor is planning to do a mammogram around that time. And so this is an issue that comes up in a few different scenarios. Again, this is something that goes away with time, and if it's very severe, can be treated with steroids, but in most cases, this will be something that's monitored and then will go away as the immune system kind of acclimates back to normal after the vaccine. Other reactions that have been reported. So some of you may have heard of this Guillain-Barré syndrome, where your nerves stop working as well, and you can get issues with motor function and sensation. And these are neurologic type reactions to the vaccine. No Guillain-Barré syndrome has been reported after the mRNA vaccines, although a few patients have had Bell's palsy, which is a condition where the facial nerve doesn't work as well. And so you can get partial drooping and paralysis of the face. And they did see this in some of the clinical trials, 8 cases in 36,000 patients for Pfizer and 4 in 36,000 for Moderna approximately. The important thing to note though is this can happen randomly to patients. without any kind of exposure or medication or vaccine. And when you compare what's the random rate in the general population, just Joe walking down the street, what's his chances of getting this versus the patients in the clinical trial, it's not any different. And so while this did occur in the trials after vaccination, it does not significantly increase your risk compared to if you're just out there walking the street living your normal life. So a little bit more about allergic reactions to the Janssen vaccine. So those are actually much less common than what's been reported with the Pfizer and Moderna vaccines. And so you had one allergic reaction, which was not classified as severe or anaphylactic in the clinical trial for the Janssen vaccine. And the Johnson & Johnson is being studied in a lot of other countries as well, because it's a one-shot vaccine. You don't have to store it at as cool of temperatures, so it's easier to transport around the world. And there's a trial in South Africa where they gave it to 110,000 patients. And there's only one case of a severe allergic reaction. So the chances of having an allergic reaction to the Johnson & Johnson or Janssen vaccine is even lower than with Pfizer or Moderna. One thing you may have seen in the news, though, is blood clots. So this is not an allergic reaction, but it is an immune reaction to the vaccine. And 15 cases have been reported with 8 million doses, so very low rate overall. And there was a lot of publicity around this because the FDA paused the vaccine for 10 days to review the risks. So they did their job. They've been keeping an eye on, all the reported effects with the vaccine. If they see a problem, they're going to pause the vaccine to address it and review it and make sure that they're not putting citizens at risk. And so what they found when they paused and looked at these clots that were occurring, that this seemed to happen more in women less than 50. And that group was the greatest risk, although there have been some cases now reported in folks above the age of 60. But really, the thing that stood out is this seems to be happening more in younger women. And they looked at, okay, what's the risk of the blood clot from the vaccine versus, getting the infection and then having a blood clot related to that and dying from the infection. And what they found is the rate of these blood clots with the vaccine are so low that it's far outweighed by the risk of having a blood clot and dying from the actual infection itself. So yes, this is a potential risk of the vaccine, but it's so low that it's a better bet than not getting vaccinated, potentially getting COVID, and then ending up in the ICU developing blood clots and dying from COVID itself. So what about patients with immune issues? This comes up a lot in the allergy world. We also treat patients on immune suppressants that are immune deficient, that can't fight infection as well as they should. Can they get these vaccines or not? And that's a question I often get. And the short answer is yes. And the reason for that is that they do not contain live virus. And so Pfizer and Moderna, as I mentioned before, are messenger RNA, mRNA vaccines. And so there's no live virus. You're giving your cells RNA so they can then produce the spike protein on their own, and you can generate an immune response. So you're not going to get infection itself from the Pfizer or Moderna vaccines. The Johnson & Johnson vaccine does use a virus, but it's not considered a live virus in the traditional sense because it's replication deficient. That's a fancy term for it's a virus that cannot replicate itself. So yes, you do have a virus that enters your cell and then gives the cell DNA to produce the spike protein. But because they've designed the virus to not be able to replicate or duplicate itself, you're not going to get infection from the Johnson & Johnson vaccine either. And so patients with immune system problems that are immunocompromised can receive these vaccines. They're not going to get COVID-19 infection from the vaccines themselves. But one question that often comes up is, doc, my immune system doesn't work well, or I'm on a medicine that suppresses my immune system. Am I going to respond to these vaccines? Is it even worth it? And so I would say that the answer is maybe. And so there are some patients that only one part of their immune system is not working, the other parts work. And these vaccines can generate immunity in a lot of different ways. We often think about antibodies being made as the only way vaccines work, but they actually train other parts of your immune system to fight infection as well. And so there are a lot of patients that only have partially compromised immunity. And so what does that mean? That means they can have a partial response to the vaccine. And over time, we are studying patients that are immune compromised and get these vaccines to see how much of an immune response they generate. And so I expect we'll have more information on this in the future. But if we think about how these vaccines work and how our immune system works, there is a good reason to think that you'll still get a partial response to the vaccine. Now, autoimmune conditions, a lot of folks have autoimmune problems, whether it's lupus or rheumatoid, for example, or some other inflammation-based arthritis. And so should they get the vaccines? And I would say the answer is yes. But the caveat here is that anytime you activate the immune system, whether that's an infection, a non-COVID-19 based vaccine, or a COVID-19 vaccine, there's a chance you can make autoimmune conditions worse. And so you may have a flare-up of your lupus, for example. And so you gotta weigh the risks and benefits. But since there's so many other risks with getting COVID itself, like being hospitalized, having a breathing tube, dying from infection itself, getting blood clots from the infection, I think that you got to weigh the risks, all the potential bad things that happen with the infection versus the possibility of potentially having a flare of your autoimmune condition after the vaccine. So kind of temporary discomfort potentially for long-term protection. So something to think about and talk to your doctors about that are treating your autoimmune conditions. But just because you have an autoimmune condition doesn't mean you can't get these vaccines. And then one other thing that often comes up in our allergy clinic is patients with mast cell problems. So mast cells are a type of white blood cell that cause allergies for a lot of patients. They're in your lung, in your nose. They can cause symptoms of seasonal allergies and asthma, for example. And some patients have abnormal mast cells, meaning they have too many mast cells, and they're really at high risk of having an allergic reaction. And we did a study here at U of M that showed that many of these patients can receive the vaccine and not have any issues with it. And so even in those patients that are at high risk of severe allergic reactions due to their medical condition, can tolerate these vaccines well. So who should see an allergy doctor before they get the vaccine? So these are some of our screening questions that we often use when we see a patient in clinic. And the most important thing is, have you had an immediate reaction, which the CDC defines as within 4 hours, to an injectable medication, a prior vaccine, or something that contained one of those preservatives that are in the vaccines, like polyethylene glycol, PEG, or polysorbate. So if you answer yes to any of these questions, you should probably see an allergy doctor before you decide to get the vaccine, so they can help figure out, do you really need to avoid it because of a potential allergy to a component, or is this something that you can safely receive? And then the other thing is, as many of you are probably aware, the Pfizer and Moderna vaccines are a 2-dose vaccine. And so if you've had a reaction to the first dose of the vaccine, you should discuss it with your doctor and potentially see an allergist before getting the second dose to figure out, was this a side effect? Was it a non-allergic reaction? Or was this something I really need to worry about? That means I should potentially avoid the second dose of the vaccine, or maybe get, a different vaccine as the second dose. And so there are a couple different things to think about there. I get a lot of folks who ask me, Doc, I reacted to the first dose of Pfizer or Moderna. Should I get Johnson for my second dose? And the answer is maybe. And I think there are important things to know there. One is, we don't know if mixing vaccines gives you the same level of protection as using both the same vaccine together. All the percentage you see 80% protection, 90% protection, 95% protection, are based on studies that looked at the same vaccine being given in 2 doses, whether that's Pfizer and Pfizer, Moderna and Moderna. No one's looked at, if I get Pfizer and Moderna first and then give Johnson, what level of protection do I get? And there are some studies in Europe now that show if you mix vaccines, that you're more likely to have side effects. So like fevers, muscle aches, chills, something needs to be treated with Tylenol, for example. Not that you're going to have more allergic reactions. We don't know that information yet. It needs to be studied. But there is some evidence now suggesting that you may have more side effects if you mix the vaccines. And so there's a risk-benefit trade-off there, and just things to keep in mind about, when you're thinking about, should I get a different dose or a different vaccine for my second dose? And so kind of to summarize the things we discussed today, COVID-19 vaccine side effects are similar to side effects of other vaccines for the most part. The one example I gave where that's not true is the lymph node swelling, for example. Severe allergic reactions to COVID-19 vaccines are rare and low. So overall, if you look at everything averaged together, you're talking 1 to 2 cases. For some vaccines, it might be slightly higher, for some slightly lower, like for Johnson & Johnson, but overall, the rate is very, very, very low. Most allergic reactions to vaccines are due to the inactive ingredient as opposed to the part of the vaccine that is the virus itself, or the virus component. And the risks associated with the vaccine in general are significantly lower than the risks with actual COVID infection. And I think one thing that's particularly important to keep in mind here is a lot of times when we think about allergic reactions or risk of allergy, we think about allergy versus not reacting. We don't think about, allergy versus getting the infection and having a bad outcome from the infection. And so I think what's really important is, if you're a high risk patient, over 60 chronic medical conditions like high blood pressure, heart disease, diabetes, things that can compromise your health in a lot of different ways. For you, it might be a much bigger deal not to get that second dose as opposed to someone who's in their 20s and pretty healthy and is low risk overall. So, for every patient, that risk benefit scenario is going to be a little bit different. But I would say for the vast majority of folks, that the risks of the vaccine are significantly lower than the risks from actual COVID itself. And those are the two things you really need to be weighing. If I'm not going to get vaccinated and then I get COVID, what are the things that can happen, as opposed to I'm going to react to the vaccine, I'm just going to think about not getting the vaccine. You need to actually compare it to, the risks with getting COVID itself. And then, in summary, most patients, other than those few specific allergy cases that I mentioned, can safely receive the COVID-19 vaccine. If you have a history of a severe allergic reaction to the first dose of the COVID vaccine or to those components, for example, the PEG or polysorbate, you should see your doctor before getting the vaccine. And then the other thing that we now know from studies from Israel, the United States, and Europe, is that if you get a COVID vaccine, it not only reduces your risk of infection, but it also reduces transmission. So if you're one of those unlucky few that do get the infection after getting your vaccine, because nothing is 100%, you are going to spread it less to the people around you if you've been vaccinated. And the reason for that is, even though your immune system's not perfect, it's been trained to clean the virus up better than just fighting it without any prior training. And so really you're protecting your community and yourself when you get vaccinated. So, that's another important reason to consider vaccination. Thank you for your time and attention.
Thank you, Dr. Kokar. And we will come back. There are some questions that have been placed in the chat, as well as some free submitted questions prior to the talk that we will go into. But I want to give Dr. Berg an opportunity to talk with us about pregnancy, breastfeeding, and the COVID vaccine. And so, Dr. Berg?
Hi, thank you, Alfreda. Thank you guys for having me. I'm just gonna sort of talk a little bit about COVID vaccination and pregnancy and breastfeeding. And so, like Dr. Kokar said, the absolute risk for severe COVID-19 infection, although it's low, for pregnancy, observational data demonstrates that pregnant women with COVID-19 have an increased risk of death, ICU admission, ventilation and support when you compare them to symptomatic non-pregnant women of reproductive age. In addition, pregnant women with comorbidities like obesity and diabetes also have a higher risk of severe illness consistent with that in the general population with similar comorbidities. And for pregnancy itself, so there's an increased risk of preterm birth. And there also is an increased risk of adverse pregnancy complications, and such as like preeclampsia, coagulopathy, and stillbirth. And the studies and the data are still currently being collected, but there's definitely been some association of stillbirths with COVID infection. The CDC has included pregnancy as a factor that leads to increased risk for severe COVID-19 illness. And the CDC, as well as the ACIP, in collaboration with the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics, have issued guidance that indicates that COVID-19 vaccines should not be withheld from pregnant women. And although pregnant women were not included in the original trials, the evolving clinical data and the data from thousands of pregnant women who've already chosen to receive COVID-19 vaccination show that there's no increased adverse pregnancy outcomes, no increased risk of adverse pregnancy outcomes like miscarriage, stillbirth, preterm birth, congenital anomalies, and other things. Also, the vaccine is not going to cause infection. As Dr. Kokar said, it's not going to cause you to get a COVID-19 infection, either in the mother or the baby. The vaccine can be given at any time during pregnancy and may even provide some level of protection to your baby, either in utero or during breastfeeding, as the antibodies produced in response to the vaccine have been found in umbilical cord blood and breast milk. And in fact, there's a prospective cohort study published from 2 academic centers that show that vaccinated pregnant women and lactating women generated a higher antibody titer than those observed in women who actually got COVID infection during pregnancy. So the vaccine provided even higher antibody titers. And so given everything we know about the vaccine at this point, like most things in pregnancy, you really just need to weigh the risk and the benefits. In this case, we have not seen any pregnancy-related safety risk with vaccination, but we have seen significant risk to baby and mom with COVID infection during pregnancy. The clinical trials to evaluate the safety and the efficacy of COVID-19 vaccines in pregnancy and in pregnant women are still underway. And like all vaccines, we're studying this very carefully. We're gathering data every day, and we'll continue to study this for many years. So, and the take-home message is, if you're pregnant or you're breastfeeding, COVID vaccination is safe for you.
Thank you, Dr. Berg, for sharing that. I want to thank all of our panelists for what you have provided us today as far as information and education, and want to thank Mr. Williamson, who will need to sign off early, but want to thank him for his participation as well. And so now I'd like to turn this over to some questions. Some of them have been submitted prior to this talk, and then some that are coming in right now. And so the first question I have is for Dr. Kokar. And the question is, someone who just submitted this morning, is could monoclonal treatment be used in place of the vaccine for lupus patients?
So that's an excellent question. So with the monoclonal antibodies, they are effective in treating early infection. And so you have to get it early, and antibodies are cleared over time. And so it's not something that's long lasting. And so I would say if you have COVID, and you have a potentially immune compromising condition, there's a role for monoclonal antibodies in that case, but it's not going to generate an immune response that can give you potentially sustained benefit. And so I would say long-term, I would still recommend the vaccine, but there may be a role for some patients with the monoclonal antibodies.
Thank you. Thank you. Now, Dr. Berg, there's a question that was submitted previously that talks about the stage of pregnancy. At what stage should you get vaccinated? And so the question is, what stage of pregnancy is safe for the COVID vaccine shot? And then you've already spoken a little bit about this, that there's nothing that necessarily says it leads to miscarriage, but if you could just expand on that a little bit, we'd appreciate it. Thank you.
No problem. Great questions. There's no, as mentioned before, there's no increased risk of adverse pregnancy outcomes that have been shown so far, including miscarriage. And the vaccine is actually safe in any trimester during pregnancy.
Okay, thank you. So going back to you, Dr. Kokar, this question, a family member of the questionnaire, of the person who's posing this question, has EOE, MCAS, OAS, and many IgE activated allergies. I'm assuming you know what that is. I can read them, but I can't tell you. And so the question that they have is, the vaccine safe for those with multiple allergy-related syndromes?
That's an excellent question. And I would say that based on my experience seeing these patients in the clinic and what's been published so far, nothing has definitively identified allergies as a risk factor for these vaccines and reacting to them. So EOE is inflammation of the swallowing tube, the esophagus, and we have no reason to think that getting the vaccine would worsen or change that condition. And I've had patients with EOE be successfully vaccinated without an issue. That doesn't mean that every single patient with EOE is not going to have a problem, but certainly it has not been identified as a risk factor. In regards to the mast cell activation syndrome question, the MCAS, so I do care for patients that have MCAS. I have patients with an MCAS that have received the vaccine without a problem, and I do not see MCAS as a risk factor for reacting to these vaccines. In the future, when we get more information, that may change. The NIH is doing a number of trials in some of these patients that there's concern that they might be higher risk where we don't know enough about these conditions. But so far, my experience has been that it's not a risk factor for these vaccines. And then the oral allergy syndrome is quite common. That I consider that to be a pollen-related allergy because you're cross-reacting between fresh fruits and vegetables and your pollen allergies. I've had patients with that condition as well receive the vaccine without an issue. Again, that doesn't mean every single patient is going to be totally fine, but I'm unaware of any studies that suggest any of those conditions are a risk factor for reacting to the vaccine.
And so would you say the best advice for this person would be to consult their primary care physician or specialist?
Absolutely,
for these
because that's
specific
the person that knows you best.
Yes, thank you. Thank you. So Dr. Berg, do you know if there's any data out there that's related to infants nursing from vaccinated mothers?
Yes, so COVID-19 vaccination for lactation and lactating moms is currently right now, there's been no evidence to show that that's causing any harm or problem to baby. There's no, baby can't be infected from breast milk from COVID vaccinated moms. You're not going to get infection. So the benefit to the baby breastfeeding is going to be the production of those antibodies that mom has produced in response to her vaccine, crossing into breast milk and arming that little baby with some passive immunity. So there's been benefits shown and no increased risk.
Right. Okay, thank you. So another question, live question from our audience participants for Dr. Kokar. What do you do if you get hives later after the COVID shot? Is that an allergic reaction or just regular allergies?
So that's an excellent question. And there have been some studies now that have some patients included that develop delayed hives after the vaccine. A lot of times we don't know the cause of hives, but sometimes the immune system can be involved. And so probably, or what might be happening in those cases is that the vaccine activated your immune system like it should have. And as a side effect of that, your immune system is now triggering the hives. So you're not having a life-threatening allergic reaction to the vaccine. It's just you have a propensity, there's something within your body where you're prone to break out in hives. And then this was kind of the trigger that revealed that. And the way we've treated those patients here at U of M has been the way you would treat anyone else with hives, allergy medications. So I would say that it's very important to consult with your personal physician in that case, because you may want to discuss with them if you should take some medicines before the vaccine. If your antihistamines, your allergy medicines need to be adjusted, for example, on the day of the vaccine. And so those are specific things based on the individual case that you should discuss with your personal provider. But certainly those hives you would treat like any other type of hives with allergy medication.
Okay. And so there's another question for either of you who might have some information about this coming from our audience today. And that is, could you talk a little bit about myocarditis and COVID vaccine?
So myocarditis has been identified in some patients after vaccination, but no definitive link has been established yet. And the CDC and FDA are actively monitoring the situation. And so there have only been a very few number of cases with millions of doses given. And so it's not clear if this is any different from your risk with the general population versus if it's related to the vaccine or other factors. And so we don't know right now, but it's being actively studied.
Okay. And for those of us who don't know, could you explain a little bit about what myocarditis is?
Of course. So myocarditis is inflammation of the muscle of the heart, which is different from pericarditis, another term folks may hear, where it's inflammation of the lining around the heart. And so myocarditis can be caused by a lot of different things. In many cases, the cause is never found. Some infections can cause it, for example. And so, anything that activates the immune system has the potential to do this. And so it's a inflammation of the heart that can be treated depending on how severe the inflammation is.
Okay, so thank you. And again, another question. So now that we know that children 12 and older are able to be vaccinated, what are some specific concerns or risks that may be associated that parents should be looking out for or thinking about?
So, I think that's an excellent question to ask. And I'm the first person to acknowledge that, while the mRNA technology is decades old, the use of mRNA vaccines in humans is very new. And, we're going to learn more about the long-term effects over time. And so I can't predict if something will be revealed or identified, years down the road. But right now, when you weigh the risks of infection versus, the risks of the vaccine, I would say you have an unknown versus a known risk situation, complications with the actual infection. So you kind of have to weigh that. I know some people are very scared of the unknown. That's human, that's normal. But I think that, again, the two reasons to consider getting vaccinated is, even though the pediatric age group, the children, are at low risk of severe complications. Some children do have severe infections. Some children do die from COVID, and some folks do develop that multi-inflammatory syndrome after COVID infection, which has been described mostly in children. And so even though the risks are small, there is the potential for some life-threatening things to occur. And the other thing is, it's not just about protecting the kids, right? It's about protecting their grandparents, their aunts and uncles, folks that are around with chronic medical problems, because we do have data showing that the vaccines reduce transmission if you do become infected. And so not only to protect kids from those few rare severe complications, but also to reduce transmissions to others are things that I would say are potential benefits of that age group getting vaccinated. In terms to what to look out for, I would still look out for the same things that you do in adults. They're going to have some side effects from the vaccines, as most people do. Arm may hurt, may get a little bit of redness or swelling, may feel fever, fatigued, chilled. Those side effects are more common in folks that are younger, in younger adults at least. And so there's a chance that there may be some more of those side effects with the vaccines in children, because they do activate the immune system. So, see those side effects, which are expected things and can be treated with over-the-counter medications. So very similar to what you would do with an adult.
Okay. And Dr. Bird, one of the questions that we have seen that continues to come up after we have done the webinars is about infertility in both men and women. And so I'm wondering if you could speak to the question is, does the vaccine possibly make you infertile? Is there anything that's in the literature or in the research that speaks to that you can share?
That's a great question. Again, there's a lot of patients who talk to me about this on a regular basis. There's a lot of information out there that patients have been reading, and these claims of infertility. But these claims are unfounded and have been scientifically disproven. There is no scientific evidence to support that the vaccine is harmful to women and cause any infertility issues for men, really, or women. And the mechanism, given the mechanism and action and the safety profile of these vaccines, they are not a cause of infertility.
Okay.
And so are safe for both men and women.
So in follow-up to that, so a follow-up question is, so women who suffer infertility issues, PCOS, endometriosis, will the vaccine be harmful for them?
No, not at all.
Okay.
Same evidence to show there's definitely no increased risk. The vaccine won't worsen your PCOS or worsen your endometriosis.
Okay. And so here's another general question for either of you. And this person writes, my concern is trust of the vaccine. Years ago, I received the flu shot and I was told I would not get the flu, but I did. Likewise, I had my first vaccine and 2 weeks later, I contracted COVID. By the way, I have lupus and I'm taking suppressive medicine.
So I think there's a number of good things raised in that question. It's a good question. And I think it's important to address a few different things. I don't know all the specifics of this individual's case, but I would say that, nothing is 100%, right? And so there are going to be some people that do everything right and still get the infection, and that sucks, to be frank. It is what it is. But at the same time, like, you're reducing the severity of infection and transmission of infection. So even if you get the infection, you're like, I went through all that effort. I may have stood in line, I suffered these side effects, and I still got the infection. That's not the ideal outcome. I totally acknowledge that. But you're still getting benefit from the vaccine in those other ways that I mentioned: reduced severity, meaning you're not ending up in the ICU on a breathing tube with severe lung damage for folks that have been vaccinated. And you're still protecting your family members, friends, and loved ones, because you've reduced transmission even though you have infection, which has been shown with the mRNA vaccines now in more than one study. And so there's still that potential benefit. The other thing this individual mentioned was it was 2 weeks after a dose, but they didn't mention if it was the first dose or second dose, and what type of, what series of vaccine that they were getting. And so until you are 2 weeks after your second dose for the Pfizer and Moderna vaccines, you don't reach that full immunity, because it takes time for your immune system to recognize it, process it, and build itself up so it's ready for future infection.
Mhm.
So there could have been a number of other factors in that case.
Right. This infection happened after the first dose. Received the
Okay.
first vaccine, don't know which one,
Mhm.
but after the first vaccine, 2 weeks later, contracted COVID.
Yeah, so they were not at full level of protection then. So, I think it's not fair to the vaccine, I guess, in that case. It didn't have a chance to build up full immunity before encountering the virus.
Okay, thank you. And then another question for Dr. Berg. The participant asked, if I am currently weaning my infant, how long should I try to have them nurse while vaccinated to ensure they receive the antibodies?
I mean, I would still go along with the traditional recommendation of that's by the American Academy for Pediatrics is 1 year of nursing is what's recommended. I wouldn't change that recommendation based on COVID vaccination. We still recommend 1 year of breastfeeding. And so it just really depends on, for this participant, where they are in that cycle. If they are getting a COVID vaccine during their lactating time, any amount of protection that you can pass along in breast milk is going to be helpful. So I would say some is better than none. So.
Okay, thank you. And so another general question for either of you, what medical conditions would prohibit someone from getting the vaccine?
So I can speak to this from the allergy side. So, when the CDC was giving guidance to everyone on who should get the vaccine versus not, there's only 2 cases where they've said you shouldn't receive the vaccine, or 2 what we call contraindications in the medical world. And that's if you've had a severe allergic reaction, not side effect or non-allergic, to the first dose of the vaccine, or you've had a severe allergic reaction to a known excipient or known preservative in the vaccine, the PEG or polysorbate. And so I put emphasis on allergic because a lot of what's described as allergy is not proven allergy. It ends up being a side effect or a non-allergic cause. But those very 2 specific cases are the contraindications to vaccination. And so those are the 2 scenarios where you shouldn't get the vaccine. And I'll defer to Dr. Berg on OBGYN conditions because I don't have as much knowledge there.
Yeah, and it's actually no different for obstetric patients or for lactating moms. The contraindications are the same as the general population.
Okay, thank you. So is there a specific vaccine that's recommended if you are someone who has allergies?
So that's an excellent question. I would say it depends on the specific patient scenario. Within my family, for example, I got the Pfizer vaccine, my mother and sister got Moderna, and my dad got Johnson and Johnson. And so I think early on it was availability, you got what you could get. But now when you have a choice, I think there are a few different things to consider. If you have a PEG allergy, for example, which is the vast minority of patients, then you should get a non-PEG vaccine, like the Johnson and Johnson, for example. If you have issue with polysorbate, then you should consider Pfizer or Moderna, for example, from an allergy standpoint. And so, the other thing to consider is the blood clotting risk. So, if you're a young woman on birth control, I can understand why you would be hesitant about getting the Johnson and Johnson. And for that type of patient, I would say it makes more sense for you to get the Pfizer or Moderna. But it's not what I would call a contraindication. So I'm not saying that don't get the Johnson and Johnson under any circumstance, because again, the risk of clotting is very, very, very low compared to birth control or other things like smoking, for example. But for that specific patient, sharing the decision making. If it was my patient that I was seeing and it's a young woman on birth control and she's worried about clotting, I would say it makes more sense for you to get Pfizer or Moderna. That doesn't mean you can't get Johnson and Johnson, but that's what I would advise to. So it depends on the individual patient and their situation, and that's why your personal physician is the best person to help you make that decision.
Okay, thank you. And Dr. Berg, I don't know if you can really answer this question, have enough information to answer this question, but it was posed earlier. How would the vaccine impact a nursing mother and baby that has been diagnosed with a rare disease?
I guess I'm not certain of what specifically what rare disease they've been diagnosed with. Without knowing that information, I would still say that given what we know right now, it is still perfectly safe for moms, pregnant moms, and nursing moms to receive vaccination. The contraindications, as Dr. Chokar mentioned, are the same for pregnant and lactating moms as they are for the general population. So short of like not knowing, what this rare condition is, I really can't answer that question more specifically than that, other than just the contraindications are no different.
Thank you. And so there have been some questions around organ transplants. And so I'm wondering if you can talk about it, either one of you have some information or can answer the question around organ transplant recipients' immunity from COVID-19 vaccine. Should they still get vaccinated or should they not?
So that's an excellent question. I think, as I mentioned, I put those patients in the immunocompromised category, assuming they're on immune suppressant medications to not reject their transplant. There's people who don't generate as strong of an immune response, but because these vaccines are not live vaccines and there's the potential for a partial immune response, if it was my patient, I generally recommend that they consider getting vaccinated in that case. Because if you get the infection and you have a compromised immune system, it's going to be harder for you to clear the virus and fight it off naturally. So anything you can do to prepare yourself in the event that you encounter this virus in the future, even if it's only a partial immune response, I think would be beneficial. But it depends on the individual patient, their degree of immune suppression, if those medications can be adjusted. And so I would say that, again, personal physician is the best person to address the specific case, but in general, yes, if you have an organ transplant, you're probably on immune suppressants and you're not going to have as strong of an immune response as someone who is not immune suppressed, but that doesn't mean there won't be no immune response. And so I think that since these are not live vaccines and you're not going to get the infection from the vaccine itself, that there's potential benefit to getting vaccinated.
Okay, thank you. And then another question for either of you, please address the efficacy of the vaccine for patients who take Humira and other immunosuppressive medications, if you can.
I feel like I'm talking too much here, but I think for the Humira, is used to treat a lot of conditions, autoimmune conditions, for example, different bowel diseases like inflammatory bowel disease, and we don't have that data. So the reason I say partial is because I expect if part of your immune system is blocked, that you're not going to have as strong of an immune response. That doesn't mean no immune response. We're going to have to study these patients long-term, 6 months, 12 months down the road, folks on these meds that get the vaccine and see how efficacious it is in them, in the clinical trials for these vaccines. Other than HIV, patients with immune disorders, immune deficiency were excluded. And so we don't know from the clinical trials what the efficacy would be in that patient population on drugs like Humira, but I would predict that they would have a partial immune response. And again, I think that there's more benefit than risk in getting it, but I can't give you a specific percentage of how efficacious it would be for that individual patient.
Okay. And Dr. Berg, a question about menstrual cycles and changes. Where the person posed the question, I've heard that the vaccine can change your menstrual cycle. Why is that, and what are the long-term effects?
That's a very good question, and a question I hear, I swear, every day. There have been a lot of women taken to online blogs and talking about their menstrual cycle changes, but right now, the experts are really still studying this. Interestingly, no women in the clinical trials reported menstrual cycle changes after receiving the vaccine. And many things, can affect menstrual cycles, like stress, change in your schedule, issues with sleeping, changes in your diet and exercise can change your menstrual cycle. Also, infections can impact your menstrual cycle as well. And given, the way this vaccine works, it, generates an immune response. It's feasible that women may experience a change in their menstrual cycle, but this should be transient and not a long-term problem. And so if you do have a cycle change that happens and that persists, I would recommend you follow up with your healthcare provider for more of evaluation. And so, it's possible that the vaccine can cause a change, but again, it should be a transient, short-term type of an issue.
Mhm. Okay, thank you.
Mhm.
And then another general question: are there pre-existing conditions or risk factors that make some groups more susceptible to death after taking the vaccine? And so whoever would like to answer first. Dr. Berger, if you have something, we'll start with you to give Dr. Kokar.
So I'm sorry, can you repeat the question for me?
So what pre-existing conditions, risk factors make some groups more susceptible to death after taking the vaccine? So I don't know if there's anything in the literature that speaks to that.
The only thing that I've seen are reports of people who have died from COVID infection after getting the COVID vaccine were mostly older adults or adults in fragile conditions, like with serious other medical comorbidities. That's about as much as I know for that particular population. I know that number is very, very small from the millions of people that have been vaccinated. But obviously, I think the last time I heard a figure was something like 70 people in the United States with over 50 million vaccinated. Only 70 had had this, had that documented case of death after COVID vaccination.
Mhm. Okay, thank you. And Dr. Kokar, you kind of touched on this when you talked about the GI tract. There is a question about how likely is it that COVID will affect the GI tract in some patients? And what does that mean for patients who have Crohn's disease?
So that's an excellent question. The minority of patients will have GI symptoms with COVID infection, but I have seen, 2 or 3 cases in my clinic where the patient had, diarrhea and no other symptoms from their COVID infection. So generally, GI symptoms are rarer than like fever or, shortness of breath, respiratory symptoms. For the patients with Crohn's disease, so, I think it depends on the severity of the Crohn's disease and what medications they're on. So if it's someone who is on a lot of immune suppressant for their Crohn's disease and then they get COVID, they could have trouble clearing the infection and a lot of problems. But as far as I'm aware, Crohn's disease itself has not been linked as a risk factor for severe poor outcomes with COVID-19 infection. And so I don't know that it would significantly increase your risk of having something bad happen with COVID. The major risk factors are age and cardiovascular disease, like high blood pressure, for example. So those are really the major risk factors that have been identified, or pre-existing severe lung disease. But Crohn's disease, I don't think has been linked as a risk factor.
Okay. And then another question again on the line for young people, and that is, what are the long-term side effects of mRNA vaccine on young people? Has there been anything that has talked about that yet?
So that's an excellent question. And the short answer is we don't know. But again, I think that you're weighing unknown versus known issues with the infection. So studies have shown that if you have COVID-19 infection, that many patients will have at least one symptom 2 to 6 months after infection. And some people may be familiar with the long haulers, now called post-acute COVID syndrome. And so there are a lot of long-term effects from the infection. And it's many patients, for those lingering symptoms, it's 50 to 66% of patients that can have lingering symptoms. And the rate of getting the post-acute COVID syndrome is still being studied, so I don't have an exact number for you there. But that's a known potential issue versus an unknown. And sometimes the unknown can be scarier than the known, the devil you know versus the devil you don't know. But as far as I'm aware, no long-term effects from the vaccine have been described yet 6 months after vaccination, other than continued immunity and protection from the virus. And so it's something that we'll learn more about in the future and continue to monitor. But we, at this point, don't really know if there's going to be any long-term effects from these vaccines other than immunity.
Okay, thank you. And so 2 questions that came up, one before and one during, and that is, were immunocompromised patients included in the trials? And if not, are there plans to be included in future trials around lupus or any other autoimmune, people with immune issues in the clinical trials?
So I think I touched on this a little bit earlier, but patients with HIV were included in the clinical trials. That data is still being analyzed and needs to be published. But when you look at the numbers of the efficacy and the safety overall, that includes those patients as part of the whole. And so that specific group was included. Folks with other immunocompromising conditions, on immune suppressants, or a lot of autoimmune medical problems that require these medications generally are excluded from initial vaccine trials because you have to prove you can generate an immune response. And so you don't want to start with someone that already has compromised immunity because that could significantly affect the outcomes. I wish these patients were included in more trials so we had better data. But as far as I'm aware, there's no planned trials for the specific group of patients. But that doesn't necessarily mean you shouldn't be vaccinated. Although it is frustrating because you want to know how people like you have done before with this, right? So I understand where these patients are coming from, but these type of patients are generally not part of initial vaccine trials.
Okay. And then another general question for either you or Dr. Berg. Is the vaccine harmful to those who suffer from anemia or any blood disorder?
I think you'd have to be very specific about the other blood disorder. So coagulopathies, obviously, Dr. Kokar had talked about the TTS syndrome that could occur with the Johnson & Johnson vaccine, even though the risk is very, very low. But for anemia in general, there's not any evidence that I'm aware of that's shown patients who have anemia would have any adverse reaction to COVID vaccination.
Mm-hmm. And then finally, what suggestions do you have for how to reach residents not interested in the vaccine? And what would your message include?
For me, I think just having a little bit of empathy, knowing from where people are coming from, asking questions as opposed to passing judgment. I think we need to understand what it is that scares people about the vaccine and do our best to try to facilitate conversation and provide information. But I think it's really going to start with just being empathetic to their situation.
Dr. Kokar, I'd like to add something to that.
I think I agree 100% with Dr. Berg's statement. It's about understanding where people are coming from. And one of the reasons I went into medicine is because I believe in people. And so I think that people want to protect their community, protect their loved ones, and contribute to the rest of the country to make it a safer place for everybody. And I think that as long as the message is not just about protecting yourself, it's about protecting your community. And helping those that may not be able to get the vaccine for one reason or another, or folks that are at greater risk from COVID, have risk factors, the grandparents in the population that may have a lot of medical problems or because of their age may be at increased risk. And so it's about protecting others. And I do believe that resonates with a lot of people because I think at the end of the day, people want to help other people.
Mm-hmm. Mm-hmm. Most definitely. And I think the other thing that we can do is to also make sure that we have the correct information, that we can be those trusted messengers for our family members. I've said before that, normally I'll get a question and then I'll get the answer and then I'll share it. And then I trust you, if I'm sharing it with my mother, there's going to be at least 3 or 4 more people who are going to get that answer because she's going to tell them because they've already said, free to work in healthcare, can you talk to her? Ask this question. And so I do think that the more that we can stay informed and the more information that we have and can share is also one of the best things. And we're doing it because we care about our people and we want to go back to being able to enjoy a nice dinner somewhere, to be able to just connect on a more social level. And so I want to thank you both, Dr. Kokar, Dr. Berg, for joining us today. We appreciate you being here. I want to remind folks that there is a link to the town hall evaluation in the Zoom chat. And also, I think it's been posted on Facebook. And when you're filling out your evaluation, if there are additional questions that were not answered, other specialists that you would like to have hear from, please let us know that. We are constantly working to make sure that we're providing the most current and up-to-date information to help you make the best decision for yourself. If there are other questions that you have, please continue to submit those. Again, we remind you that the best person to help you make your decision is your personal primary care physician. If you do not have one, please let us know, and we will work with you on for finding some resources for you. And so is there a next slide, please? Okay. And if you could go back one slide, please, Sarah. Yes, thank you. We also want to make sure that you're aware of other resources that are happening in community. On June 29th, our Mishar SEAL program will be hosting a town hall, so save the date for that. And they'll also have another one on July 27th, so please just mark those down. As more additional information is available, we will share that. And then we'd also like to make you aware of something that one of our community partners, the Community Family Life Center, is having grief counseling, a two-part series. The next session is on Thursday, June 10th. And so we want you to take advantage of that opportunity to learn more about grief counseling and to get support. This has been a year in our pandemic, has been a year of loss on many levels, both personal, family members, societal, and how we engage with people and connect. And so grief is something that we are all dealing with, and we should really be open and honest about talking about what's happening with that. And so these are some opportunities for you to have those conversations. Next slide, please. And so once again, we thank you. Please remember to complete the evaluation forms. If there are other questions that you have, please feel free to submit them. This recording will be available at a later date on our YouTube page. So look for those announcements for that. And without further ado, I just want to tell the organizers, our committee who works to put these together, we appreciate you. Thank you so much for your participation, and all of our partners. Matter of fact, Sarah, I skipped over our partner file, our partner slide in the beginning. If you wouldn't mind going back to that, please. So these are our partners. And what we have learned through this time of the COVID and the pandemic is that we are stronger together and that we can leverage more information and reach more people by working as in a partnership. And so please, we want to take the opportunity to thank all of our partners who are listed here. The Ministerial Alliance of Ypsilanti, Ann Arbor, and vicinity, our St. Joe partners between St. Joe, Ann Arbor, and we've had some input from Chelsea as well, Washtenaw County Health Department, St. Paul Missionary Baptist Church, Bethel AME Church, the Turner African American Services Council, Messiah's Temple, Washtenaw Community College, Grace Fellowship Church, and the Michigan Institute for Clinical and Health Research, and New Hope Baptist Church. We appreciate all of your partnership and all of the work that we're doing to educate community. And so with that, enjoy your Saturday, be safe, and have a great week. Thank you.